Hi, good evening, everybody. Welcome to the People's Forum's panel on the people's response to the crisis. Applause will not protect us. The reality of healthcare workers on the front lines. My name is Dan Jones. I'm part of the Popular Education Project and the University of the Poor. I'm also a member of Put People First Pennsylvania and of the Florida Coordinating Committee of the Poor People's Campaign, a national call for moral revival. I'm very excited for tonight's webinar. We have a really great group of people to talk with and learn from tonight. This particular event is part of a series that I can't recommend highly enough that the People's Forum has been organizing, this series of the people's response to the crisis, which has just been this really fantastic and invaluable set of educational and agitational and inspirational webinars that the People's Forum has been organizing since this pandemic really hit the United States. And it's been this recurring online place to hear current and urgent reports of people's movements from across the United States and around the world, from frontline leaders and fighters, and to provide a really much deeper than we usually get, a much deeper analysis and a much more grounded perspective on the problems that are facing humanity today, and in particular in the midst of this pandemic and growing economic crisis. And so if this is your first time tuning in to one of these webinars, I can't recommend strongly enough that after you finish watching this one, you go to the People's Forum's YouTube channel and watch all of the others. So tonight, again, the title for our panel is Applause Will Not Protect Us, the Reality of Healthcare Workers on the Front Lines. And we're very honored and we're very excited to have with us three leaders who are all deeply tied to the kinds of struggles that are being waged and the organizing that's being done among healthcare workers on this crucial front of struggle in the face of this pandemic today. So we're joined by Cris Hilo, who's a registered nurse and a member of Gabriela, New York, and a mother based in Brooklyn, New York. And we're also joined by Karim Sariahmed, who is an internal medicine resident in New York City and also a member with me of Put People First Pennsylvania. And lastly, we're joined by Sheilah Garland-Olaniran, who is part of the Illinois Poor People's Campaign, as well as the University of the Poor. She is a co-founding member of the Chicago Southeast Side Coalition to Ban Pet Coke and is part of the Southeast Environmental Task Force. She's also part of the East Chicago, Indiana Community Strategy Group and the Illinois Single Payer Network. And she is a co-founding member of the Chicago Medicare for All Coalition. Sheilah is also a recent retiree. Congratulations, Sheilah. After working for 15 years with National Nurses United as an organizer, as well as in the union's political and community organizing and government relations section. So we're so grateful, I'm so grateful to have the chance to talk with the three of you about a very serious crisis, about the very real conditions that are facing healthcare workers on the front lines. This is a situation where, like many other essential workers, right, with this label that's been applied, where healthcare workers are being celebrated as heroes, but at the same time are being forced to work in extremely dangerous conditions without even the adequate protective equipment that's needed to stay safe while caring for people. You know, I know a couple of y'all are in New York. I'm down here in Miami. You know, we've had these fighter jet Blue Angels fly over people's cities, spending hundreds of thousands of dollars and promoting militarism and the war economy, you know, as if that's a way of supporting healthcare workers, when in the meantime, folks don't have masks and don't have gowns and we don't have the equipment that we need. And, right, as Sheilah was just pointing out, we're seeing healthcare workers being laid off in the midst of this pandemic. We saw in April, almost 1.5 million healthcare workers were laid off in the middle of a public health crisis, and over 100,000 of them were healthcare workers in hospitals. So there's something going on here that needs to be explained, right? There's something going on here that needs to be understood more deeply than it's usually being talked about. And so that's our task here tonight. You know, the first and foremost, we want to lift up and to expose the injustice that's playing out in our hospitals and all throughout our healthcare system. And we also need to deepen our understanding of how we got to this point, right? The fundamental reasons for why our healthcare system has proven so completely incapable of coping with this pandemic, both for patients and for healthcare workers. And then lastly, we want to make sure we talk about the kind of response this crisis is calling for, the kind of organizing response we're seeing, and the kind of opportunities that are opening up, especially in terms of organizing among healthcare workers and among healthcare workers as part of a much broader movement of the laid off and unemployed, of people who can't get care, of other essential workers, and everyone else, right, who's suffering in the midst of this pandemic and the pre-existing crises. So hopefully we'll be able to touch on all of that and more with the very brief time that we have tonight. And the first thing we wanted to do, though, was to begin with a discussion of the reality at the front lines, of the conditions. And so I wanted to ask you, Karim, to start and to describe the conditions that you and that others working at your hospital have been dealing with, working in during this crisis. So please, Karim.
Yeah, sure. Hi, everyone. So I'm a medicine resident. So that what that means is I finished medical school. Now I'm a doctor, and I practice medicine under supervision in an academic medical center. And so residents are a huge kind of reserve of kind of elastic labor for hospitals, and we were basically doctors who work like 70 to 80. Maybe much more than that, many hours more than that if you start to talk about surgery residents, and we're a huge sort of source of very easily exploitable labor for the hospital. There are like some very particular like power dynamics and working conditions that we deal with, which are related to the sort of odd history of medicine and the political isolation of doctors in particular, and of all of the sectors of health workers, which we can talk more about later. But in terms of the conditions that we're seeing, and especially I think the ones that are common to many kinds of healthcare workers, the question of sort of PPE comes to mind most immediately, because I think it was just this very emblematic and very apparent and practical need that sprung up very early on in this crisis. And it was this thing that so many people were organized around in this kind of whirlwind moment where many people who sort of weren't really looking to connect with others in any form of working class or organization or otherwise, saw this kind of instability where like, oh wait, there's no guarantee that this basic, fundamental, practical, valuable thing will be provided to me in my workplace, and I need to figure out how to do it on my own. And since then, that's improved to a degree in some places. I work in an academic medical center, which is one of the places that is like, has kind of the best resources in the healthcare system. But like as Cris was mentioning the other day, like if you go to a nursing home, that may not necessarily be the case. And so those are health workers too, who are just in need of just as much protection. And then in terms of what I think about in terms of our baseline working conditions that are shared across the board, and I think many people will tell you are the same, but have just been worse during the pandemic. It's really just related to the stress and intensity of being asked to see the greatest number of patients and always being asked to work at capacity, work the longest you can, see the greatest number of patients you can, every bed in the hospital full at all times. If you're discharging a patient in the morning, then it means you're going to admit a patient in the afternoon, almost without question. And there's always a line of people from the emergency department waiting to come in. And that's really chaotic. It's disorganized. And because we work in such silos, we stress each other out, and we put pressure on each other, and we get mad at each other, and we get, the residents get frustrated with the nurses, and the nurses like get frustrated with the residents, and we get on the phone with the pharmacy people and we yell at them. And the whole culture that we're sort of indoctrinated and socialized into, and I know I was told as a medical student, is like, your job is to like call people and make sure they're doing what they're supposed to be doing in this pseudo managerial role. And I think that tension, which I'm sure Cris can say a lot more about, is such a hallmark. And you throw that into a pandemic, and it's a big mess, and it's a really horrible condition to work in.
Thanks, Karim. Cris, would you also want to speak to the conditions that you and others that you're working with and in contact with are facing this pandemic?
Thanks, Kareem. I was just laughing because I really hope I'm not that bad when I'm with those residents. You know, it's hard when you have to juggle so many patients and we want to get things done. But I think through this time of COVID, actually, in my hospital, 20% of the medical residents were out sick at one point. So 25 out of 125 medical residents were out. So there was a lot of short staffing everywhere. And so when you see the impact, it's not just on the medical residents, it's on nurses, the doctors, it's environmental staff, the techs, everyone is impacted. Everyone was getting sick. You just see we were taking care of our own people in the hospital. Briefly, I'm a registered nurse. I'm working in Brooklyn, New York, NYP Brooklyn Methodist Hospital. And I'm a member of Gabriella, New York. The main thing during this time of the coronavirus, COVID-19, what we saw in the hospital especially was the fact that, we were not ready for this. And what's troublesome about it is the fact that in January, when we were first learning about coronavirus and Wuhan and everything, our infectious disease control, we're taking it very seriously, and we're trying to make sure that we were monitoring every single day and also making sure we were practicing proper protocol for PPE. It was airborne, contact, droplet. So you wear your N95, you wear your gown, you wear a face shield of some sort. And then CDC decided to just make that all gone, like everything that was supposed to protect staff and patients just vanished, like they took it away for a reason. Supposedly there's a shortage, even though there was some type of Federal Reserve that was out there. What is the priority of this government? And the US government, that's my child, wasn't running properly and actually protecting the people. You see that they're not trying to help the workers. When they went to just surgical masks and gowns, it's like basically you're fighting this virus naked. It's so ridiculous. And yes, PPE to extent, but also in general, our hospitals were getting flooded with patients. And what I've heard from public sector hospitals especially is people weren't even given a chance to fight, because by the time they got to the hospital, they were already dead. So that's why you have so many people, especially in the emergency department, so traumatized by this. And not even them, but all nurses and all healthcare workers, especially because this is not, it's not it's not easy. And thank you to everyone out there for doing their part in making sure that we had some social distancing for the past couple of months, because it did work. We're seeing much less admissions to the hospital of COVID. We're still seeing it, but not as much in comparison to what it was in, March and April. I don't even know what month it is anymore. But that's the reality. But then what was the impact of all of this, of the lack of PPE for our workers? It was death. How many of us have to die to prove a point that we need protections? Like you can't glorify like this without giving us the proper gear. It's really it's horrible. It's horrifying. And as a Filipino worker, as I'm a daughter of a ICU nurse, it's like it's in our blood to be like healthcare workers. Not really. It's actually economics. We have if you see in the Neisner Memorial of New York State Nurses Association, I believe there's almost 26 of those nurses who have passed away that we know of on that. 6 of them are Filipino. So you have almost 25% of people who are falling or dying, who are ready for almost retirement, passing away. It's just saddening, you know? And it's not just here in New York, but also in California, all over the United States. We have a large workforce, part of our workforce are Filipino migrants that have come here. And now they're risking their lives in these conditions. And especially here, I'm actually working with nurses and CNAs in nursing homes, trying to get PPE for them because they're forgotten. Some CNAs have been telling us that they've been getting one N95 for 5 days. And during the crisis, it was already one N95 for a whole entire month. We've seen people getting sick, a lot of workers getting sick, and it's not just a regular sick. They're out for 2 to 4 weeks. But I could keep going. You better like facilitate me.
I mean, I think this is why we're here tonight, is to expose these realities and conditions. And in particular, you were just lifting up some of the aspects of this story that aren't being told. You know, some of the function of particularly kind of glorifying doctors and nurses. And none of this is to take away from the risks that people are taking, right, and the sacrifices that people are making, but has been to hide the reality of the huge numbers of low wage, you know, mostly women, you know, disproportionately immigrant people of color work being done by CNAs, by PCTs, you know, by folks who are cleaning hospitals and nursing homes and other places. And so some of that has really served, you know, not only to hide the fact that there isn't enough PPE, right, and the difficulty of the conditions, but also to limit who's understood, you know, who's counted among the sort of group of heroes on the front lines, and to limit our understanding of the failures of the healthcare system. So I think, Cris, you can feel free to continue too, if you do have more that you want to put forward, and also Karim too.
I want to hear Sheilah speak.
Perfect. Yeah, me too.
Listening to Sheilah speak clarifies my thinking always.
So Sheilah, you know, of course, I know that you're still in touch with many nurses, you know, all over the country. And so please add to this discussion about the conditions people are facing. But I think as well, you know, given that, you know, for 15 years, you were in the mix of organizing among healthcare workers, you know, fighting against the kinds of changes and transformations and attacks on people's working conditions that set up this current crisis, that it would be really great if you could begin to bring our discussion as well to why this is happening. You know, why was our healthcare system already short-staffed? You know, why did PPE run out so quickly? Why did our healthcare system completely fail, is continuing to fail to meet the real challenge of this public health crisis? So please, Sheilah.
Wow. Okay. First of all, thank you so much to the People's Forum for hosting this particular webinar. I think it's extraordinarily timely. I'm really very honored to be on a panel with Cris and Karim, and John as he, Dan as he hosts us and keeps us on track. So a lot of times I always tell the story that I grew up in Flint, Michigan, and I always tell people I grew up in Flint, Michigan because I had a front seat row at a tremendous shift in how goods and services were produced in this country. And if people know Flint was in many respects the birthplace of the auto workers union. It was really the birth of the modern union movement. And so I had an opportunity, you know, to see firsthand not only union organizing, but how workers endeavor to maintain power in an often shifting economic system of industrialism, of industrialized production. When I grew up in Flint, there were over 100,000 workers engaged in auto work. Today, there are probably less than 10,000 auto workers in the city of Flint engaged in auto work. And so what that means is that, you know, workers are being impacted in many different ways, not just those folks that worked at the point of production in the auto factories, but the communities and the families who relied upon that industry in order to provide for themselves. And those jobs often, carried with them good healthcare benefits, retirement, those sorts of things. So all the things that we sort of, talk about today, we see that those things are being extraordinarily shifted. And my 15 years working at National Nurses United, and even prior to that, really beginning to see and understand how this new technology has been applied to the healthcare industry. Healthcare, it's also shifted from what was primarily non-for-profit method of production to a lean, mean production just in time. And so as I'm listening to Karim and Cris talk about the challenges that frontline healthcare workers have faced, especially with personal protection equipment, PPEs, and just all the necessary, the ventilators, and all the necessary tools that were needed, these things were already in short supply heading into the pandemic. Capitalism produces what it needs under this new technology. And so it has been known world over that there was some sort of pandemic that could be expected. Countries were advised to begin to produce up in order to make sure that there was equipment and those things necessary when the pandemic arose. But even more than that, what was the underlying sort of impact of not having all of the equipment and all of the tools necessary in order to fight this pandemic under capitalism, right? Because that's what we're really talking about. Because we've seen in China, Vietnam, and Cuba, and other countries that are more socialist in their orientation, that they've been able to arrest the pandemic, that they've been able to deal with it with a focus on humanity. But in this country and other European countries, even those countries that were touted as having some of the best healthcare that we want to model in this country, Medicare for all, that their systems were absolutely tattered and stretched beyond, capacity because they could not cope. So it's this question of how do you shift in an environment of private production and private distribution in order to produce in a mass way so that it can be socially available when it's needed, how it's needed, and where it's needed. And how do you coordinate that in a government where our dictators are capitalists? I mean, let's be realistic. This is the dictatorship of the capitalists. They dictate what's going to be good for them and for their bottom line. And when you have an economy that looks at the social needs of humanity, then you're going to look at what's going to be good for all of humanity. And so I just wanted to go back and just do a little bit of a dive, if I can. I don't want to talk too long. But the shift in productive forces required a concurrent shift in hospitals to policies and priorities that shifted from primarily nonprofit to in hospitals and care delivery, which were of course dominated by the HMOs, as we know, back in the 60s and the 70s. And then that was all calibrated with the creation of various metrics and protocols to determine how frontline workers would deliver care. And this is what has created this, I think, eerily perfect storm we're experiencing now. And it's a reflection of the application of the technology in the delivery of healthcare, as I talked about earlier. So what we see chronic short staffing in hospitals. This is because if you're going to maximize profit, you want to be able to play with the variable of how many people you have actually available to provide the care you need. You give doctors a matrix, a formula to determine how care is going to be administered to certain patients. And that can be calibrated to include some of the racist policies that we've heard about in most recent time about how care is delivered, in particular to Black and Brown people, or to people who they think don't have the income to pay for the extended care. All of these things are factored in before the pandemic and how we got care in this country, aside from its general scarcity for the things that people really needed, like primary care in our communities, in urban communities and in rural communities. And on top of all this, so if I'm not making sense, Dan, just feel free to jump in, but on top of all this, right, here comes the pandemic. And within that pandemic, all of the implications of a highly technicalized, just-in-time, lean, mean delivery of healthcare rears its head. We're in a capitalist system, and the system cannot shift, because otherwise it's going to undercut its purpose, how it functions. It just can't. And all of the laws and the bills that are being passed have nothing to do with guaranteeing the security of the workers who are engaged at the front line and across all of society, but it has everything to do with securing the capital and all of the institutions of capital that the capitalists need in order to maintain their rule and control. And this is why healthcare in its current state, prior to the pandemic, and even more so exposed now in the pandemic, cannot deliver. And it raises, to me, two real serious questions about how do we move forward in this period to organize and connect with those folks that are deeply impacted. If you think about it, healthcare is something that we all need. At some point, we're all going to be a patient. It is one of the most unifying struggles that we can engage in this country. It touches all of us in one way, form, or another, regardless of how we want to view it about how it should be delivered. Everybody will one day need some sort of a healthcare, whether it's because you're being born, and if you never see anybody, it's at the point of death, right? But even during that, in order to protect ourselves with various vaccines and healthcare and checkups and all these things, we all need some sort of healthcare. And so for me, from a very political perspective, this is probably one of the most, and that's why I'm so grateful for this discussion, it's probably one of the most important fronts of struggle that we can organize vast numbers of people and really talk to in different ways. And I want to add one more aspect to that organizing, because I think Karim and Cris also talked about the impact of the current healthcare system on them as frontline workers, but also on their patients. You see, the patient and the frontline healthcare workers are natural allies. We're natural allies because we all will need that care. And part of the reason that the healthcare industry, and I'm going to call it an industry, works so hard to create a schism between the healthcare workers, the doctors and the nurses, and the patients. Think about how our hospitals are set up. You go into an emergency, the first person you meet is probably some sort of armed security guard. You don't meet a healthcare worker, you meet an armed security guard. Then you're asked to wait. Because why? Because there are not enough people to take care of you when you walk into the emergency. And in some emergency rooms, even before the pandemic, the wait could be, 8, 6, 7, 8 hours, in some hospitals a day, depending on where you have to go. That builds up a lot of tension. And because there aren't any mechanisms within the system, because it's all about keeping us divided, it becomes explosive. And we see the patient sees healthcare and the healthcare workers as their natural enemy, and the healthcare workers see the patients as their natural enemy. And so now we have a divided struggle, whereas we are fighting the same entity, which is that system of healthcare delivery within this system of capitalism. So we have to really think about what are the tools and what are the mechanisms of control? Because in order to maintain a dictatorship, you have to figure out the methods of control. And this is what we're seeing. And now on top of all of this, and then I'm going to shut up, we now have 1.4 million healthcare workers that have lost their jobs, with more to come. The stimulus packet included like $100 billion to healthcare so that they could keep rural and struggling hospitals open. Where is that money coming? Because all of the electives and all the things that hospitals engage in to make money, to feed the market, to feed their CEO, to monetize every single decision, those algorithms that the doctors have to adhere to in hospitals to not only get their bonuses and to do all those other things, but it also means that they can calibrate how much money they're going to make. That's what those algorithms are for in determining how care is delivered. So now you add in this stimulus money, and a lot of these hospitals, they will go back to delivering that kind of care, but now they're going to be even leaner and meaner because they will have shed millions of workers at the front line. So that to me, that really clues us in as to how we proceed in our organizing and who it is that we talk to, how we talk. And I will get into that because I think because we are in extraordinarily revolutionary times, if we don't think these are revolutionary times, then I don't know. I mean, maybe because I'm a revolutionary, but these are very revolutionary times, which means that we can have very different conversations with people because people are seeing the same things that we are. They just don't necessarily have an explanation about what's happening. But there's a foundation for a lot of unity among workers and our patients across the country in order to begin to shift not only the conversation, but develop the networks and the relationships among workers that we need in order to address this dictatorship of the capitalists.
Thank you, Sheilah. I know that Cris, you had wanted to make some comments on this theme as well. Yeah.
And I think what's important, what Sheilah's talking about, is the macro aspect of what is happening to us right now. The fact that there is not enough resources. Where is the resources going? There are so many people as workers. We are all paying our taxes, right? Now, where is that money going? Okay, that money is going to war. A large chunk of it is going to the military industrial complex, which is also hurting all of the countries a lot of immigrants come from. For example, the Philippines, where there's a lot of human rights violations. That aspect needs to be understood, that we need to take control of that federal budget and actually make it for the people and not for private industries to make profit. What I wanted to talk about resources on the front lines, like for our patients, what is happening is that if we don't have the resources, we can't take care of them. And there was such a need for ventilators. And I remember, because I kept following the news and whatnot, but instead of it, even Trump was just questioning the idea of ventilators. And then we are still trying to understand COVID-19 on and what its impact on the bodies are and people. And the fact is, it's not just our lungs. It's also it's impacting the kidney. So you need dialysis machines, you need ECMO machines, you need so many other machines. For my hospital alone, there's only 2 ECMOs machines, okay? And so there is definitely a lack of resources. And how many hospitals in New York City were closed down by the government because they said, oh, that's not necessary, we don't need that. So it's not about, we have to change the idea of healthcare not being run for profit, but being actually for the people. And I think in the aspect of resources, like I had a friend call me up and ask me like, hey, like my friend's uncle needs dialysis, but the hospital is refusing because there's no machines. Like, these are certain things that we need to make better. We need to figure this out. And another thing about COVID-19, especially that people aren't talking about, and how we're all connected, healthcare and the people and the patients and whatnot, is the fact that why New York City got hit so bad, and the media will spin it as very much as they want, the fact that, Black and Latinx people are, they already have these comorbidities of diabetes and whatnot. But what about the fact that the population that we have in New York City, there's a lot of poor people, and the fact that our living conditions, how many people per apartment? 4, 5, 7, 8, 9 per one apartment of 3-bedroom apartment. How you stack your apartment with rooms. And a lot of people aren't talking about the fact of this. And especially, I had one patient so scared his breathing would be so bad because he was so anxious. He was so anxious to go anywhere, to go home, because he wouldn't just bring it back to his uncle. He would bring it back to 1, 2, 3 other rooms full of 2 or 3 other people. You know, that's scary because this is a very contagious virus. Another aspect of resources that we need to I want to talk about also, is the fact that our human resources, how many of these healthcare workers are immigrant migrants coming, you know? And I'm just taking from the context of the Philippines, is the fact that we've been exporting people since like day one, right? This is a historical lens. If we can't just talk about this crisis only in the blink of an eye of 2020, but since the 1970s, Filipinos have been coming to the US, being the healthcare workers, being the nurses here in the United States and all over the world. Like we're everywhere. There are about 7,000 Filipinos leaving the Philippines daily to be workers across the globe. 20% of the healthcare workers in New York and California are Filipino. So to the extent that there's something about the fact that we as migrant labor from the very beginnings in the 1970s were seen as cheaper labor to come from the Philippines to the US to help supply these so-called shortages of healthcare workers in the United States. And it hasn't stopped, and it still continues. And I think that it's just important that, you know, for in the Philippines context, like during times of COVID, they actually said, stay, we want the nurses to finally stay. Like, you cannot leave, you have to stay so that we could take care of the people. And it's like the first time I'm like, what? But the reality is like, these countries that we're coming from, that are semi-colonial and semi-feudal, like we need to continue to start to build them up so that we can actually have some type of form of national industry so that we can stay and actually take care, because this is generations and generations of people leaving. You know, it's saddening and maddening because the people who are dying on the front lines, you know, like my mom did it all the time. It's like we would send like Biden boxes back home. You know, there's always a connection of the Philippines and home. And this one of the women who actually passed away, she was the head nurse in the ED in Kings County, which is in Brooklyn, which is a level 1 trauma center. Her name is Maria Gia Cabellon. My friends work with her, and you know, she was like this close to retiring and getting back to her home, to be at home in the Philippines. Spent 30 years in Kings County, being the amazing nurse that she is. But all of this, like being at the front lines, and this is the sacrifices that we've made as healthcare workers. But like, we have to do better for our workers, because as of right now, like, and even if there's a second surge or a third surge or whatnot, like it's a bigger discussion of the fact that our organizing has to continue to change the healthcare system so that we don't have this type of response to such a pandemic where we are not prioritizing the health of our workers and especially our community.
Thank you, Cris. Karim?
Thank you so much, Cris. I wanted to just throw in briefly, we're talking about some of the mechanisms by which this happens, and also like foregrounding the poor in sort of our analysis of how these things happen. And I think Medicaid is like one sort of like important way of framing and thinking about what happens, especially in our safety net hospitals, where so many like poor folks are getting their care. and you think about how, you know, Medicaid has the lowest reimbursement rates compared to other kinds of insurance. And then you also have people who don't even qualify for Medicaid, who are left out of it, who are also getting care at those same hospitals. And yet those hospitals, like the one I work at, they still manage to, you know, pay their CEOs, like, you know, my CEO makes like $10 million, $13 million. How do you do that? Sort of getting the lowest form of reimbursement from the poorest people in the city, the poorest people in the country. Like, you do it in a few different ways, and like one of the key ones is to like hyper exploit your workers. We've already talked about that, of course, and we like, I mean, all of the hospital workers in New York City, like there's this reputation of like it being a really intense and like tough place to work. But then there's also this huge question of hospital closures that are happening all over the place, and the like financialization of the assets of healthcare and the things that are actually valuable in healthcare, which is like work and beds and protective equipment and medications, and those things being kind of wrapped in these financial markets where sort of the ruling class and people at the top and CEOs and private equity managers can sort of move those financial assets around in a way that benefits them at the expense of those people who are getting sort of the lowest form of care available in our system. And so in my system, so Mount Vernon Hospital, it's one of the places in the Bronx that has the blackest population, and it's getting closed by Montefiore Medical Center. And that was one of the fights that that NYSNA had its eye on before the pandemic hit, and that's what we were really thinking about, because like they extract sort of those necessary services. They shut down services, not just in Mount Vernon, but in Westchester Square. Another hospital that was sort of stripped and turned into a more profitable kind of center with a more limited range of services. And then the people who can afford to will maybe go get their care somewhere else down the street that has better services. The other folks stay there. And then when the census goes down and they can't have a constant turnover of people getting admitted and getting discharged and collecting those pennies, like collecting the low level reimbursement on those poor patients, but a lot of it. They say, oh, we have to close this hospital, it's not working out. Meanwhile, they're acquiring property elsewhere, just in the Bronx. And so it's so important to sort of like foreground people who are on Medicaid and what's actually happening to them materially. What is the care that they're getting? It's worse care than folks get in other places, and it's not because the doctors who work in the poor places and the nurses and the techs and the EVS people are worse workers. It's because the system is designed to exploit people. And we experience that exploitation too, and it's a strong point of connection. And so that's what we have to bring in, like the fights against hospital closures, not just in urban centers, but also in rural places. Those are the poor places where poor people are getting exploited in the same exact way.
Thank you, Karim, and thank all of y'all for what you put on the table. I mean, I think one of the things that we see from all of your comments is that as soon as you scratch below the surface, even just a little bit, it becomes impossible to talk about the healthcare system and the conditions that healthcare workers are facing without talking about the entirety of the social and political and economic system that we live in. You know, you can't talk about it separate from immigration and imperialism and militarism. You can't talk about it separate from poverty as a whole. You can't talk about these issues separated from technological change and automation, you know, and speed ups in the replacement of labor. You can't talk about these issues without looking at the role of financial capital and private equity. You can't talk about these issues without getting into questions of austerity, right? And the question of why public hospitals are being closed down while military budgets are increasing, you know. And so I think one of the key themes that's emerging here that I think takes us to the next part of this discussion is the interconnection, right, of the struggles and the dangerous conditions that healthcare workers on the front lines are facing with all of the other evils and injustices in our society and the structural roots of those injustices, in the ways that that creates in reality, you know, what you were talking about, Sheilah, of a natural alliance among these different, you know, forces and sections of our society that are intentionally, you know, disunited and kept apart from each other. And so I want us to turn to some of the questions then, you know, of which this analysis, which I think we could go on for at least another 45 minutes, you know, deepening our understanding of what's produced these conditions and how it ties in, you know, to these other interlocking injustices in our society. And maybe we can propose more webinars on this topic. But I also want us to talk about, this is about the people's response to the crisis, you know, which has to be a grounded and informed, you know, and sophisticated response. And it has to involve, you know, organizing. It has to involve finding, you know, ways and forms and means of building across lines of division for people to take action together. And so we're going to move to that section. I did want to say quickly, though, for anybody watching via Zoom or via YouTube, we may have time for kind of questions from the public, folks just tuning in. And so please feel free, you know, either through the YouTube comments or through the Zoom chat to pose questions for the panelists to respond to a little bit later on. And hopefully we'll have time for that. But so the question that I wanted to raise is, you know, Sheilah, you indicated that these are revolutionary times, that these are times of both extreme danger and risk and sacrifice for all kinds of people, and of opportunity, you know, where some of these, you know, the reality of who shares interests and who has interests that are opposed to each other is more and more visible every day if we can seize on that opportunity and make it real. And so the question that I wanted to pose to you all is, what kinds of responses are you seeing, you know, particularly in terms of organizing among healthcare workers? You know, are people starting to organize in new ways and overcome some of the obstacles that you've spoken to? You know, Karim, I know you mentioned some of the isolation and the division that exists among different kinds of healthcare workers. And Cris, you spoke to that as well. And so are some of those divisions, are you starting to see organizing happen to overcome those and other obstacles to politically conscious and clear and politically independent organizing among healthcare workers? And similarly, you know, with the divide between healthcare workers and patients, or healthcare workers and other kinds of workers, or healthcare workers and, you know, and anybody else who is part of this, you know, 140 million poor folks in this country, and with, you know, poor and dispossessed people around the world. So I know that's a big question, but maybe we could start with you actually, Karim, if that would be okay, in terms of kind of organizing opportunities and efforts that you're seeing emerge.
Yeah, so I mean, I can say a little bit about this, just both from like the perspective of like Put People First Pennsylvania and like how that's taking place. I obviously don't live in Pennsylvania anymore, but I'm still a member, and I work closely with folks in the organization, and more recently with like healthcare workers who are responding to this as part of the whole organization. And then later I can also mention a little bit about organizing in the hospital. So I think like just this premise of that health workers are working class has been like sort of a kind of a discourse that we've been trying to push and raise and agitate people around for a long time, because we saw that sort of exploitation as something that is shared, and we were like drawn to that natural allyship. And I think there were small attempts, and there are like many healthcare workers like who are members of Put People First, who are just a part of the life of the organization, just like anybody else. Now I think in this moment, there are some like more particular and like specialized roles that are and needs that are arising, and sort of like on one of the sort of like statewide calls that was had, one of the healthcare workers just got on and was just kind of explaining it just in some like relatively simple terms, just basic like need to know things about the coronavirus. There's so much disinformation. And there were like 70 people on this call, and I think for many of them, this was the first time that they were like getting really clear information from someone who was trained and sort of knows about the virus and how to protect yourself from it. And it just speaks to this feeling, and also the opportunity to sort of turn that into like people being able to ask, well, how come I had to go and sort of do this on my own? How come we don't have systems in place in the richest country in the world that protects us and teaches us how to take care of our bodies? And then just, become, all of that work trying to be organized and have it be a part of the lifeblood of the whole organization, and not just like, oh, this is like the committee of healthcare workers, like they talk about their healthcare worker issues over here. Like, no, for the practice of healthcare workers organizing as working class people and in working class organizations is to be members of those organizations and to be part of the life of the whole organization, and inserting those skills and inserting that value and those perspectives into all of the work that affects like all of the people who are part of the organization, and affects us too, as we've sort of described. And in terms of organizing in the hospital, it's sort of like a new and different like terrain for me. I'm like more used to working in Put People First, kind of a people's organization that operates in this kind of manner, in this membership role. And the terrain for organizing in healthcare workers, for health workers, is very much a union model, which is a slightly different thing. And there are also sort of differences there. And so like the nurses are like the sort of best organized and have the most sophisticated like analysis and organization and the most power, honestly, when it comes to sort of organizations of health workers. And then there are other larger organizations for other folks who work in the hospital. SEIU 1199 is sort of one of the big ones. And then something that I've only found out more recently, because there was like a bonus, there was pressure put on like administration to have like hazard pay or something like that. And it's sort of getting distributed unequally. Like we're not even sure who's getting it yet, but we know who's not getting it. So like we've heard about, how the security guards, they're part of some other like union with like the cops or something like that, and so they're not getting it. They're not health workers, even though they stand at the front and they're sort of like checking people's badges, and they're exposed as much as anybody else is. And the environmental services workers, the gravest injustice of this time is the environmental service workers not being given the dignity and respect of being health workers who are contributing just as much value and doing just as much to protect folks as doctors and nurses are. And they're like, oh, some of you are like charter workers, so you're not sort of going to get paid anymore for the risk that you're taking on. And so I think people are identifying that issue, and it's just, and at least in my local context, where our residents aren't even unionized. We're like the only non-unionized residency program in the Bronx. And we're trying to figure out how to deal with that in a sort of really complex environment where like the National Labor Rights Board is like has federally appointed people who don't want to let any people start new unions. Trying to organize in different ways is sort of a new challenge. And then I think there's this dynamic of, well, there's so much organizing opportunity just out in the world. There's 140 million poor people who are many of whom are probably more ready to organize now and are recognizing the necessity of it, and who we need to kind of find ways to partner with. And I think like I encounter a lot of like hesitancy on the part of health workers about that, like feelings of guilt of like, oh, I'm not, that's like the community over there, and I'm in here and I have to focus on my sort of issue. And if I kind of go into the community, which is somehow separate from me, even though they're sort of right in front of me and I'm talking to them every day and getting paid for it, that's going to produce some kind of intermittent relational harm. And I think we really need to work through that in order to like partner in meaningful ways and really confront the people who are hurting all of us.
Thank you, Karim. Can we turn to you next, Cris, and then you, Sheilah? Sorry.
For organizing, I see that there is definitely a lot of organizing had to happen in these past 2 months in order to make sure that there was some push on local government, federal government to actually give proper PPE. And that is, it was important and it was necessary, and it's just the beginning. You know, the reality is, if we look at the numbers, yeah, New York actually, if you see the curve go down or whatnot, but the rest of the United States, that still keep going up. That's not going down. So that means that we have to keep looking at it everywhere. And I think, especially, like, there was just, solidarity is so important. And, um, you know, what was some of the beautiful things in this crisis was the fact that there were so many nurses that came from out of state to come and help. And, it's not, it's like, you're coming to help us during this time of a pandemic where this virus can, you know, if you're lucky or not, like, you won't get sick, or you might get mildly sick, or you might get really sick. Like, I think there's aspects of, like, where you could see, like, if we actually work together, maybe there's potential of all of us actually coming together to work, to fight for a better society. The reality is, of those traveler nurses, that they weren't getting paid well in those states that they were originally, especially the South. I have a lot of folks from Tennessee, Georgia, Alabama, Arkansas. Like, their wages are definitely much smaller than what they got as traveler nurses here in New York City. So, you know what? More power to them. Thank you for and helping us. And some of them are still here, especially during, as we flatten the curve or whatnot. But I think, organizing, there's a lot of mutual aid networks that were created by people in the community. Like, there's so many people that there's just so much potential. Like, random strangers giving masks. Like, after work, I would just go and meet somebody in a mutual aid network and get masks. And I also organize with National Alliance for Filipino Concerns, and we're not just giving masks, or we're not just giving food for healthcare workers. There is actual, some type of political education that is added on to these needs, because why, when you hear of other countries that are out there that all of their aid is actually given to them, they don't have to fight for them, they don't have to, like, try so hard to, or line up for hours for food banks. You see the lines of people in their cars waiting for food banks. Like, this is a time where we need to fight together. And the government, if they can bail out the banks, if they could bail out their corporations with trillions of dollars, even though it only had a small impact on Wall Street, then why not bail out us, who are paying the taxes, who are working our tails off all the time? Like, it doesn't make any sense that we are not being taken care of. We're getting what, 1,200, like, not even, some people getting that 1,200 stimulus. 1,200 is nothing for some people, a lot of people, and especially if you have a family. So I just think that, it just shows the cruelty of the government that we live in, that is not trying their hardest to make us safe, and then also to make us secure, especially our families, who, for food. It's something that we have to fight for and to link up even after. But this isn't going anywhere. The numbers are still increasing, and we have to pay attention to this, because I know I'm in New York and I see the numbers decreasing, but everywhere else in the United States where those numbers are increasing, it's like, it's potential time to organize, and also to figure out all those things of our learned lessons, to figure out how to help one another during this time, especially for our people and our communities. Yeah, this is ripe time for organizing. And we have to, because, you know, our people need it. Our people need the help. Sheilah, go ahead. Tell me how to organize.
Hi, Dan. I didn't want to take over your role. Is that okay? Okay. Thanks, Chris. Thanks, Karim. I mean, I think that a few things, I mean, obviously this has been a very important discussion, you know, given this epical, I mean, I never thought in my entire life that I would see something like this, you know, happening in this country, happening around the world. And, you know, I'm thinking about various forms of organizing because, you know, all kinds of organizing is taking place. Some, you know, to address immediate concerns, but, you know, really virtually every act of fighting and resisting, whether it be in the form of mutual aid, projects of survival during this pandemic, have the potential to bring us together, which is really important. But more than that, it exposes, as Chris and Karim have discussed, the extraordinarily vulnerability and just the lack of capacity capitalism has to address this pandemic and all of the issues that were with us prior to the pandemic. And so, for example, I know that National Nurses United was organizing around the lack of personal protection equipment. And, you know, really looking back in history and saying, you know, there was a point when the coal miners were organizing and they accepted bonus pay, but they didn't get the standards they needed. And so their people still ended up in the same position they didn't want to be in. So, you know, there are tactics in how we move forward, but there's an overarching sort of political strategy about where does our organizing lead us. And I think I learned something from I don't know if people know General Baker. He was the he was the key leader and formed the League of Revolutionary Black Workers in Detroit. And when the Detroit riots broke out, I remember him telling me, he said, you know, we had done all this great organizing and we thought we were, you know, we knew everything that was going to happen. We could, you know, help to mold whatever was going to happen. But when when spontaneousness happens, you know, everything is up for grabs at that point. So there will be spontaneous movements, but if there is an element of consciousness within that spontaneity, we'll be able to extract more leaders, more revolutionaries, and people are really thinking about how do we network and organize and create the structures that we need in order to address what we need as humanity. I wanted to, because I'm glad that Chris mentioned, you know, these mutual aid and projects of survival, because these mutual aid and projects of survival are deeply rooted in our culture. One, because we've always had to come up with alternatives of survival through slavery, you know, various forms of capitalism. And so these are really, I think we're hardwired. But what those mutual aids and projects of survival, as Chris was saying, there has to be a conscious element to that really talks about where are we in this political process, in this revolutionary process? Because it's really difficult to fight when you don't really have an army, when we're not talking to each other, we're not networking with each other with sort of a common understanding about what it is that we can achieve now. What we can achieve this year may be different from what we can achieve in 2 years based on where things are. But if we don't have a good assessment by communicating with one another, networking with one another in these projects, and really beginning to break down those divisions that have kept us from these important conversations and these important interactions that we need to have with one another, then it's going to be, you know, we're going to squander this opportunity. I just want to finish. I just wanted to say that, you know, it is really clear that this pandemic, that capitalism is in deep crisis. It's in an even deeper crisis. It cannot address the pandemic because it's not set up to do so. This is where the role of revolutionaries and those who are fighting for basic needs converge. Healthcare is a unifying struggle, and the demand to be protected from the impact of the virus while also being able to survive economically have reached the domain of revolutionaries and those fighting to survive. As I said, projects of survival and mutual aid become even more critical as they allow fighters and those who are impacted, frontline healthcare workers and patients, to discover one another in a context we can strive to impact. The ruling class, that is the dictators of capitalism, are fearful that the various ties that keep us tethered to their dying system are being stretched to their breaking point, and they are fearful. They rely upon and they develop new and improved methods of control, and it is our job as thinkers, fighters, revolutionaries to fight to unify our class on the various fronts we find ourselves fighting, and to understand the points of unity, politicize it, collectivize it, and fight for it.
Thank you, Sheilah. And thank you, Cris and Karim as well. We are getting close to the end of our time. I hope that Cris comes back. We're getting close to the end of our time, and just a reminder, I saw that a couple of people had raised their hands to ask questions, and that is very exciting, and we won't be able to get the questions unless you actually put them as text in the Q&A or in the chat, however it's set up on Zoom or on YouTube. So sorry about that, but we would love to at least see your questions. So I think this was a really profound discussion of the kind of political clarity and orientation that has to guide our organizing in this moment of crisis and opportunity. And so I really thank y'all for that. And so as we move to close this discussion, one of the things that's clear, and you said this, Cris, is that you pointed to, I think this was the right word, the cruelty, right, of this government and of this system in regards to denying people the right to healthcare that could be met. The means are at hand to meet this need that people have for healthcare, for food, and for everything else that we need to survive. And so in particular, we see that this cruelty manifests as how profit is prioritized over care in our system. And so I think if as we move to begin to close, if you all have more you want to say about some of the cruelties of this system, to please do so. And I think we before we end would want to say something about how we imagine a healthcare system built around social solidarity, built around securing well-being, built around putting the resources of our society, at the service of the needs of our society and of the poor and dispossessed in particular. And I think as much as we want to imagine that, we also see it, and so if there are things from other parts of the world, other healthcare systems around the world that we've already pointed to a little bit, but that you all would want to point to as some examples, some kind of lights, some kind of guidance for us to look at of what it would mean to reorganize our healthcare system. And also y'all have talked about some of this mutual aid and projects of survival. And so, have we seen this even in our own context in the US, what it would mean to reorganize our healthcare system around need and not profit? Have we seen that emerging from below? But so I wanted to start with you, Cris. And so I'm sorry to pose like 3 questions at one towards the closing here, but both if there's more to say about the cruelties of this system, and then also, how do we imagine a healthcare system and really a society organized around a different set of values, and where do we already see that around the world and from below here in the US? Please, Cris.
So I think another thing that I just have to mention is the fact that there is disproportionate impact, especially on Black and Brown communities for COVID-19. What didn't stop, and the racism didn't stop because people were at home. We saw the murder of Ahmaud Arbery in Georgia. This is telling of the times that we have to we need not just anti-capitalist society, we also need an anti-racist society to really uphold our dignity as people. And I think the fact that it's like you can't get a day of rest, like not just your communities are dying, the communities are dying. Now you have just the racism that happens on the daily in our communities. And so I think that, I think that we have to organize as much as possible so that these, like, these were all preventable. This is all preventable. How is this all preventable? If, for COVID-19, if we did mass testing, if we did actually do precautions of and educating everybody of why it's so important. And then also, there's just the reality that if we use our if we use our federal tax money and actual tax money to uphold human rights instead of do human rights violations all over the world, we could have a better society. Like, that's it. Okay. Like, Vietnam did a great job of actually with this public health crisis. Cuba is amazing because they're also helping out other countries in the world. They sent people to Italy, to South Africa, to a lot of other places so that they could send not military, but they sent doctors and healthcare workers to actually help with these crises, and actually created medicine that was actually working in China during the really high times of the crisis. So I think we have to figure out. I think this is a time where you actually just think about necessities. You have your essential workers, and you realize you have to make sure that everyone has food, housing, and just like your basic human rights. And so this is a time where we just need to organize and fight for that new society. Like, and there's in Cuba, the way that public health should be is preventative care. And what Sheilah was talking about, how you have an emergency room and you have people wait. The healthcare workers in Cuba go to your home to do the checkups. They don't wait for you to come over there. They say, how are you? And then they make sure that, it's a block by block system. Everything is organized. And here you can't even, like, people don't even have health insurance, or they're not even able to go to the doctor. And people are so scared to go to the hospitals because they don't have that access right now. And we need to realize, and I hope it woke up a lot more people, that it's not working and we need to change it.
Thank you, Cris. Sheilah or Karim?
Say a little bit about just the imagining part. Something that comes to mind in thinking about imagining a society that actually works for people and what healing looks like. I think just something that you see the way our healthcare system prioritizes emergencies and prioritizes elective care, and these little the most easily commodifiable episodes of healthcare commodities that can be delivered, and builds that up. And then the things that are actually life-giving and life-sustaining, which are food and water and shelter and relationship and community and love, those, and which are the things that we're oh, that's social work, or oh, that's primary care, or that's something else, are totally starved. And I think and then the other thing that I think of too is and the way that that's related to our working condition, and the ways that we're made to work for our the entirety of our lives. And something I think of as well is the suicide rate among doctors. I think that is doctors are so, in particular, are very sort of socially and politically isolated for 1,000 different reasons. but you talk about how like how doctors have one of the highest suicide rates of any career. You lose like 400 doctors to suicide every year, I think, which is like an entire like medical school of doctors, and it's because of these working conditions and the ways that it sort of disfigures us and isolates us, and that is one of the most sort of deep forms of relationship to the whole way our economy works, which is built on this social isolation. And I think we really have to like reach into that and in order to sort of imagine what a healthcare system and a public health system and a society that actually sort of like meets our deepest needs looks like.
Wow, that was, well, thank you, Daniel. Cris and Karim, I mean, I don't know what else to add. Last year I was in Cuba for the second time. I went the year before, and then I went back last year. And the first time I went, it was really an unsatisfying visit because I was on a tour. But the second time I went, I stayed with friends, family that I met, and had a completely different experience of Cuba than, you know, just this kind of superficial touristic thing. And every day, because the family had advised the nurse that I was coming for a visit and that I had some health issues, and every day she would come to the house and check on me to make sure that I was okay. Now, I'm sure that that's not how the United States wants the services of Cuba to be given to a tourist, to a US citizen, right? But that was what happened because I was actually in the home of a family, and actually the patriarch of the family had spent quite a bit of time in Angola and had, you know, just a very strong desire to protect what they had achieved in Cuba. But Cris is right. A healthcare system that really puts, you know, that really talks about taking care of not only your physical needs, but the isolation that capitalism creates. This is a system where you are isolated, deliberately so, in our little nuclear families and all the different myriad ways that we are kept apart from one another and made fearful of one another. Really makes it challenging to do any of the organizing work that we're talking about, most particularly in a pandemic. And so breaking apart that sort of isolation, and I, you know, I'm not going to get into talking about exceptionalism. That's a whole different political discussion as well. But but just the isolation of living in the system and being made fearful, not for those people with conscience, but the vast majority of people that we encounter, you know, have this sense that, you know, I can't trust anybody that's outside of my little hub. And if I go outside of that, then there are dangers lurking. And so I think a system that looks at the totality of our health, right? Our mental, our spiritual, our physical, all of those things that make us human and humane. I think the closest system I've witnessed, and I lived for about 4 or 5 years in Europe as well, and you know, they have the kind of Medicare, socialized medicine in some of those places. But I think even with the technological advances that they were able to accomplish in Europe, it did not come anywhere close to what I witnessed in Cuba, which had a strong thread of humanity in how healthcare and how the society is organized, and just the joy of living, even though the US has had its foot on Cuba's neck with this embargo for over 60 years. And it is the most brutal embargo that has ever been imposed on a country, ever. I mean, so that means you can't get anything in Cuba because all of it is embargoed. And so I think I would look to a system that really achieves, that really brings us together as humanity, that allows us to see the humanity in one another, so that, you know, we can begin to develop into what I think who we were intended to be as a species, you know, because this system certainly brutalizes us and it beats the humanity out of us, so that we are fearful and that we cannot come together. And that's been one of the great accomplishments of capitalism that I think that we're going to have to really struggle to overcome, is this dehumanizing, isolating aspect of capitalism, which is why I value these discussions and the Poor People's Campaign and the University of the Poor and all of these mechanisms and network that draw bigger and bigger groups of people together, regardless of, you know, what our colors and our various circumstances are, but that allow us to talk to one another beyond these divisions that have been imposed upon us historically. And so that's the kind of system that I think, and I think right now in the world today, from my perspective, I think Cuba comes closest, even though it's a very poor country, but it really comes closest to delivering that kind of humanity. I did get sick when I was in Cuba, and the doctor came twice, and the nurse was there all the time, and I never felt more valued as a human being. But I felt like whatever was happening to me, I wasn't going to succumb to it, because, you know, there was such a humanity that came with the delivery of the care. And that was extraordinarily important. So I think that's where I want to end.
And I think I just want to add, Cuba is a socialist country. I think what I want to say for sure is that we must fight for socialism, right? Socialism is taking care of our basic food, housing, clothing, healthcare, education, and employment. This is a time where we've seen unemployment that is just unbelievable. So I think that during this time period, it's just really that we have to learn from it and understand that we need a better society that is actually going to take care of us as human beings, you know? And the fact that it's everyone impacted, everybody who's unemployed, if you think about it, also has a family attached to that number. And so how many millions of people that have been impacted by this? And you know, I talked to my friends in China, and they basically said, yeah, we got taken care of. People delivered food to us. And I was just like, what? Like, that's how it is sometimes in some other places, in some other countries that actually have some type of socialist perspective. But we need that here in the US because it's not working. And I think that we have to fight for it.
Thank you, Cris. Thank you, Sheilah, and thank you, Karim. And I think this is a really important note to end on, and it leads nicely into our next event, the People's Forum's next webinar, which everybody who's here should attend and bring 5, 10 more people to. And this is webinar on building working class internationalism today. You know, what we saw today is that we can't really understand and successfully wage the struggle to transform our healthcare system, or the conditions of healthcare workers, or the kind of care that sick people get in our society without a revolutionary transformation of our society, without a revolutionary transformation of the system that we live in. And we know that that system is a global system, right? And we know that that struggle is a global struggle. And so this Wednesday, May 13th at 6 o'clock, there's going to be a webinar on building working class internationalism today. It's an introduction to the International People's Assembly, a process that I think is one of the great hopes today. One of the great hopeful lights in the world today is this International People's Assembly. And so we'll hear from leaders from organizations that are part of the North American chapter of the International People's Assembly at that webinar, you know, which is about building the internationalism of the working class. We know that there's an internationalism of the rich. We know there's an internationalism of the capitalists to keep the system in place. And so we need an internationalism of the poor and dispossessed, of the working class, in order to overthrow that system and build something better. And that's what the International People's Assembly is about. And in particular, you know, building that process through a call for an international week of anti-imperialist action. And so this is going to be another series, this Building Working Class Internationalism series. This is the first one, the introduction to the International People's Assembly, and it's going to feature Vijay Prashad, the director of the Tricontinental Institute for Social Research. and Claudia de la Cruz from the People's Forum and the Popular Education Project. And so I think it's an important follow-up to this discussion, which I think got deep into questions of how we must organize and how we must respond to this crisis. And so I think it looks at many of these same dilemmas and crises and political questions from an internationalist perspective that we also took on today throughout the discussion. So thank you all so much to our panelists. Thank you to the People's Forum for organizing this webinar and all the other webinars in this series. I hope you all take care and look forward to being in struggle with all of you moving forward. Thank you.